Radio.
The Sober Lifestyle Show presented by KLEAN Residential Treatment Center.
On Angels Radio, AM 830.
Judy, your dancing alone will ensure that we never get a TV deal. I guarantee it.
We're not like everybody else. We're not looking for a TV deal.
Not anymore.
A movie deal. And we're back in the studio with Prism Award winner, star of The Closer, Anthony John Dennison, and Dr. Coe. And the number here is 877-8-830-830. 877-8-830-830. And we're also talking about right now, we've been talking about what is addiction, how do you know, but don't you think a lot of this stuff is cause and effect? You know, if you're going to the gym 4 times a day and that's affecting your life, that obviously is a problem.
Yes.
So, it
has a self-destructive component.
Right.
Yeah.
And that's how I think, you could sort of, describe addiction. It's if it's causing your life to be out of control.
Right. Well, I think the important thing that Tony was asking about also was, if you're taking medication from other people,
yes.
Is that somehow a relapse?
Well, it's
or
stupid. I don't
know about stupid, but it's dangerous potentially.
Well, I mean, dangerous.
And the truth of the matter is that addiction treatment, especially when it's not even just for addiction, but for depression or for some other ailment, it needs a real treatment professional, someone that understands the psychopharmacology that's out there and how it's used. And as I'm sure Jason can tell us, there's been rapid advancements and changes in different medications. I mean, just in the last 5 years, right, Jason? I mean,
the last really the modern era of psychopharmacology started with Prozac, which was '88, and then there were a lot of Me Too drugs like Prozac. But in the last 10 years, we've seen mood stabilizers come in that have been very effective. There's been the introduction of what they call the atypicals.
Atypical antipsychotics.
Right. And they have a lot of different characteristics that have broadened our approach to mood disorders and psychosis. They have their own problems too, the side effects.
My wife actually has a joke. She says, which is I think has a lot of truth. She goes, "Antidepressants don't make you happy; they just make you undepressed." Right? Yeah. And I think that there has been this thing like Prozac Nation when Prozac first came out. This idea that psychiatry and psychopharmacology was all about we're going to come up with like the 1984 Orwellian Soma drug, the pill that everybody will take and they won't have a problem or a real feeling that's bad.
Well, that's why taking a pill without getting therapy is almost
even if it's a pill that you've taken before when you had therapy, though.
Right. But I mean, in the sense, it's like, Dr. Coe is very big onto, we talk a lot of psychotherapy. Right. So he actually enjoys treating patients. He doesn't, you don't just go in to see Dr. Coe and he says to you for 2 minutes, well, how have you been feeling?
Here's your script.
Let me...
Well, I actually found out recently, I didn't know this, but Dr. Coe was saying to a client, who I obviously can't name, but this week that he started his practice originally without prescribing medicine. That was sort of what you were known for.
Right.
And I didn't even know that. Yeah. I've been working with you for 15, 16 years.
Where is your practice?
It was in New Orleans.
But now?
And now I'm in Beverly Hills. Oh. And that was, I worked with an analyst who was sort of a Turk.
Mm-hmm.
And
Turkish?
No, he was kind of wild
school.
and a little rebellious. And, my last year in my residency, we'd go up to Charity Hospital and we'd look for the sickest patients we could find, and then I would treat them with psychotherapy and no medicine.
But you mean you were also seeing him 5 times a week?
No, he was a supervisor.
No, I mean you would treat people with psychotherapy 5 times. You would do an analysis on whatever
up on
analytic session.
Yeah,
up on the ward on the 3rd floor at Charity Hospital, psych wards, where we could do
the best analytic work happening in Charity Hospital in New Orleans.
Another reason why I brought that up before. Well, I'm sorry, will you finish your point?
Yeah, pretty much.
Because even for myself, I had hurt my back. This is about a year or so ago, or more than a year ago, and I hurt my back, and I just even though I was going to my guy to have it to be repaired, which he did a great job. He's a kinesiologist, and but
physical therapist.
He's just amazing. But
even before it makes a big difference.
Even before I went to see him, because he's a chiropractor, but
He doesn't crack your back. He does
bones.
like deep tissue vertebrae massage.
Yeah, he moves the muscles.
And he's got a picture of Tony on his wall in his office.
But he also treats.
I swear to you. Yes.
He also treats ex-football players. And
he's
stuff.
great.
He's really good.
He's convinced that he could cure anything with vertebrae.
Yeah, muscle. Moving muscle.
I mean that, like
moving your muscles,
heart problems, anything. Everything. He's convinced he could.
Well, based on the fact that this wall of I have muscles all throughout us. But anyway, I don't want to divert too much off of that. But he, I was having this. Oh, these chairs are like a trick chair.
You got the trick chair.
So I had this really bad back, and so I called up my doctor, my medical doctor, and I said I need something. I literally was screaming just even getting out of bed. So, being sober, I'm 18 years sober, or at the time 17 years sober. I was a little nervous, but I thought, I got to do something. So he prescribed Vicodin, and I'd heard all these stories about, because I used to do a lot of pills when I was in college. Tuinals, Secanols, Dexedrine, all the uppers and downers. So I was like a little nervous about taking it. So I took like a half, and nothing happened. Then I took the other half and nothing happened. And I'm reading, it's okay, I'm supposed to take 2 every 4 hours. So I took the other one and nothing happened. It didn't get rid of the pain. I didn't even get high. I didn't get a butt. So I hurt my back again about 4 weeks ago. And I realized I still had like 6 or 7 Vicodin in my bathroom, and I thought, is it okay if I take them? I mean, I ran it by my sponsor, and he said, I don't know. He goes, I think you he goes, you might want to go in and get re-examined. He said, because maybe there's something else you can take, especially since the Vicodin didn't do anything for you.
Or maybe you're misdiagnosed.
Yeah. Or maybe they gave you they didn't give you real Vicodin.
No, I went to
the placebo.
I went to the pharmacy.
You remember, because I had actually a few years back, I had hernia surgery, and this is a huge issue because you hear a lot of stuff.
If it's a huge hernia.
It was a huge hernia, and you hear and one of the reasons we do the show is to debunk and talk about things we do here in 12-step meetings a lot, from professionals that haven't graduated high school. And one of the things you constantly hear is about drugs, and and so when I had my hernia surgery, I was like scared to take the hydrocodone that they gave me. I'm literally crawling on the floor of my friend's house, and I have this prescription, and Tony was like, okay, you're taking this.
Yeah, a hernia operation I had one. It's one of the most painful.
If they can't do it laparoscopically, they have to do the incision.
It's so painful. You move,
right?
And you think you're going to jump across
I'm literally
the room.
crawling on the floor, and Tony came over, and he's like, okay, Judah, you got to take a pill. But I had a really bad reaction to it, not in the sense like I was getting high. I started getting paranoid. I was watching a TV show that had a Russian accent on it, and I started passing out, and I thought the mob was outside. That might
be another issue.
That probably was. But then I realized if you're in a spiritual place, medicine doesn't affect you badly. If you're taking something because there's a need to take it, you're not going to go out.
Once again, that's a huge generalization, but of course, Judah, we're used to that from you.
But what's interesting about the generalizations?
They're right.
No,
they're correct. They're 100% correct.
Right is relative.
100%.
Yeah.
I mean,
they're 92% correct.
They're not. They may seem truthful. They're not. Facts can't be disputed.
Yes.
Truth can be. But I mean, there's like a part of the stuff that he says that really gives you food for thought.
Right. Well, I like that he brings up the general issue.
Well, I do believe that, though.
We need to drill down on it.
I do believe if you're in a good place spiritually and you need to take a medicine, it won't have the bad effect that people... Because you constantly hear people saying in the 12-step meetings, don't take Vicodin, don't take Vicodin.
Oh, yeah, they got to me.
My thing is that, we have doctors for a reason,
exactly.
Right? I mean, Dr. Co.
Right.
Trust me, I'm not a hero when it comes to that stuff.
Right.
Here's my turn. Let's be practical.
Right.
If you take a medicine as it's prescribed, and you don't abuse it, and if it works, that's not a problem. If you start using it after the need goes away, that's a problem.
The other thing is if you take a medication and it's not working, you need to call your doctor right away.
Yeah. If it didn't work, then, don't take it.
I mean, there's so many things out there right now, muscle relaxants, things that can actually help.
But even antidepressants.
Yeah.
I mean, the key thing is to involve yourself with your physician. I mean, I think people have, with Google, with the internet, everybody thinks they can self-diagnose.
Right.
And one of the stories I like to tell, which is actually one that I got along with Dr. Coe, there was a physician in Covington, just outside of New Orleans, who had bumped his head. And he got an infection on the top of his head and decided that he didn't need to talk to any other doctor about it because he was a physician. He could take care of it himself.
And he was a psychiatrist.
He was a psychiatrist. And he tried to treat it himself.
Really dumb. Yeah.
And he ended up dead. He died on his couch from an infection.
Yeah. I mean, it was a lingering infection, and he never consulted anybody.
Whatever happened to Sopers, the muscle relaxant that it was big in the 70s. We used to get high on it all the time. But I mean, it was like you took that and you just sat down in the chair and suddenly you fell in love with the chair.
It's like probably like Quaaludes, huh?
Quaaludes, that's sorry,
Quaaludes. Yeah.
Whatever happened to them? They discontinued them.
They were banned. Yeah. They were so abused.
Oh my God! Yeah. Well, I abused them. I mean,
they were hypnotic or sleep medicine, and they were just not safe, and they were so addictive.
They were so powerful
and abused.
Well, it's funny. Secanols were the same way. The Lily F40s, the Red Devils, they call. The one time I actually was a provider of them. I was my own little pharmacy.
I love it, Tony's Pharmacy.
So, but I had them. I had like 200 or 300 of them. Somebody fronted to me, and I got rid of them like literally in like 2.5, not even 2 days.
You know what the lethal dose is?
I have no idea.
15 pills.
Well, yeah, I'd worked up my addiction to like 6 or 7 a day, and then I finally stopped. But the thing was,
you stopped breathing.
Yeah, the thing, and it was interesting. Well, anyway, but the next day was when I felt the great effect from, or like the sort of this attitudinal shift of just sort of I just felt like I was on top of the world, And then to get back to there, I had to do more. I just didn't know how to get there on my own. But anyway, what I wanted to say about the Secanols was that for at least 7 months after I had those available, I still was getting calls from people. Hey, man, I understand you got some like Secanols. I was like,
bad.
What are you talking about? Yeah, so and so told me. I was, who's that? And then I realized how many people I didn't even know knew that I sold them, and I'm thinking to myself, my God, this is like 7-8 months later, they're still calling.
You were famous in Ithaca, New York.
No, it's New Paltz.
Oh, New Paltz.
I'm from Ithaca.
Oh, yeah.
Well, actually, I wasn't selling them. I was a provider.
It's 7 years is over, okay? There's no statute of limitation. It's fine. You were a drug dealer.
But it's a healthcare provider.
Yeah. One of the things I want to get back to about antidepressants that most people don't know is they're just as effective, if not more so, for anxiety. And people don't really know that. I think that was what everyone loved about Prozac was, suddenly the anxiety went away and they thought, oh, this is wonderful. I can do anything.
What about,
one of them has a nice side effect. So is Wellbutrin helps you quit smoking.
Yeah, or it gives you tremendous amounts of anxiety, like it did me.
Some people get very anxious.
Yeah,
anxiety because you missed your cigarettes.
No.
People can have an adverse reaction to the
medication. Yeah, anxiety, like tremendous, like bad anxiety attacks.
Yeah, back to the point of taking medicine under supervision.
Right, and I called my doctor right away, and I was like, Doc, something's a little off here. I feel like the car is coming in on me. And he's like, yeah, we might want to
dump the Wellbutrin.
Yeah, dump the Wellbutrin. Anyways, we do have to take a break.
Yes.
That's
it's radio.
It's radio time.
It seemed like we talked longer time before the first break.
That's just because Judah was talking more.
And we're in the studio with Prism Award winner Anthony John Dennison, the star of The Closer, and star of the psychiatric circuit, Dr. Coe. And the number here is 877-830-830, 877-830-830. We know Bin Laden was caught tonight. You might be listening to that. But if you have any questions about anything not concerning Osama Bin Laden, give us a call.
Or we could talk about the addiction to hunting Bin Laden.
Hunting Bin Laden, yes. And you're going to hear us, or the addiction to gas.
Right.
And we are
or
here.
war.
Yes, or war. We're here at KLEAN Radio.